Hi, Dr. Penner. How are you doing today?
I'm doing pretty well. How have you been?
I'm doing great.
Good. What brings you into the clinic today?
So I'm working on a new opioid initiative to decrease the amount of opioid prescribing in Alaska, and I was wondering if I could get your thoughts on reducing the amount of opioids you prescribe and transitioning into the multimodal non-opioid therapies.
Okay. Yeah, that sounds like a great initiative. I definitely have faced some resistance from patients in using non-opioid therapy. That being said, I've been prescribing opioids for 20 plus years now, and I'm very aware of these short-term risks with opioids. So I'm really cautious with my prescribing and very conscious of the dosing that I choose. So I've never actually seen a serious safety event from them. So I start to think, why waste my time with medications that aren't going to solve my patient's pain when I've seen opioids work for so many?
Sure, having patients achieve adequate pain control is a valid concern, but we actually have new information showing that opioids are no longer the most effective treatment for pain. And this is because when we compare patients in treatment groups that are receiving opioid versus non-opioid therapies, we're actually finding that patients are reporting a similar reduction in pain in both treatment groups. Additionally, when we use non-opioid therapies, we significantly reduce the patient's chances of experiencing a life-altering event like myocardial infarction, opioid use disorder, and overdose, which are significantly associated with opioid use.
Yeah, that brings up some good points. And I definitely want to stay on top of the literature. So what do you recommend for me starting with multimodal?
So we actually have some great treatment handouts that we put together. We have one for acute pain, we also have one for chronic pain, and these were condensed from the CDC guidelines and the VA provider guide. So they provide you with a really good overview of the information that you should know, but we do have QR codes in there if you want to do a deep dive of all those guidelines and information, or if you have any specific questions. But if you do have a specific question, I am also available, so you can call me whenever you need help, and I will do my best to answer those questions for you.
Okay, that sounds great. Yeah, with so many different guidelines out there for arthritis, fibromyalgia, it can be hard to keep on top of the best guideline-directed therapies. So it sounds like your resource of condensing some of those options for multimodal might be beneficial for me to discuss with patients. So if I have questions, where can I find you or how can I contact you?
Let me get you a card, just one second. There you go.
Okay, great. I'll review these resources and try and implement some of this with my patients. And then maybe we could follow up next month to talk about how it's been going.
Yeah, that sounds great. I'd love to follow up with you.
Okay, sounds great. I'll reach out to you soon then. Thanks for coming in today.
Yeah, thanks for your time.
Yeah, no problem.